My report is Endostar rebuilding vertical homeostasis and enhanced chemotherapy effect in cervical cancer treatment. The incidence rate of cervical cancer is higher in women and not sensitive to chemotherapy. And the tumor vertical agent can rebuild tumor blood vessel structure, increase vertical perfusion and chemotherapy effects. Endostar is such agent developed by China. In this study, cervical cancer patients with stage 2B2 accept Endostar and chemotherapy first, then give surgical operation. The results show, contrast to chemotherapy alone, Endostar and chemotherapy further increase patient 5-year overall survival. MR indicator further reduced tumor volume. DCMR prove Endostar increased tumor vertical perfusion. Posterior confirm tumor vertical multiplication increased. Tumor proliferative rate further declined. VEGF note signal connection downgraded. Our conclusion were Endostar improves cervical cancer vertical structure and perfusion, enhanced patient chemotherapy effects. Endostar, combined with chemotherapy, may provide new target therapy for cervical cancer.